Hello, Dr. Jerry Beavers here again with another COVID-19 update. This time I'll be using an Irish accent in honor of St. Patrick's Day coming up, so please enjoy. Now, as previously discussed in our first video, COVID-19 is caused by a coronavirus called SARS-CoV-2. It predominantly affects the lungs and the kidneys, as well as the heart by attaching to a receptor called ACE2. It originated in China, but has spread to more than 100 countries worldwide. Now, you may be wondering, who is going to get COVID-19? But what you're really asking is, am I going to die from COVID-19? Well, to understand, COVID-19 is just the constellation of symptoms arising from an infection by this coronavirus. And it appears to be more common in those who are older or have chronic conditions, though anyone can be infected and have mild symptoms. Those most at risk for dying appear to be older people who have chronic medical conditions, and the CDC has defined older very poorly. But as you can see from the graph at the right, most people are defining older by mortality, which means 60 years and older. They've also defined chronic conditions as heart disease, diabetes, and lung disease. If you're a man, you're 1% more likely to get COVID-19, and smoking and vaping appear to be major severity risk factors. So if you resemble the gentleman in the picture here, a man over 60 who smokes and has high blood pressure and diabetes, you're far more likely to die from COVID-19. So if this is you, I'd recommend stop smoking. For everyone else, the risk is minimal. So you may be wondering again, how do I know if I'm infected? Well, if you have fever, cough, and shortness of breath, you most likely have COVID-19, but don't panic. Seek medical attention if you feel like your shortness of breath or difficulty breathing is worsening. Call your doctor's office before you're headed in to be seen. There may be special precautions that need to be taken prior to your arrival. And our testing right now is very limited, so don't go around demanding a test like a horse's arse. And you may be saying to yourself now, says I, what do I do now that I'm infected? Well, wash your hands. I don't know if you've seen the previous video, but I don't think I can stress this enough. You can call your doctor, you can stay at home, and you can clean all the high-use areas of your home thoroughly. Avoid contact with susceptible people, as we've said so many times before. Drink plenty of fluids and take some symptomatic medications if they make you feel better. And this would be a great time to catch up on all those streaming services. Just another quick word on hoarding. Hoarding hospital protective equipment, such as the masks and gowns and gloves and sanitation supplies, only endangers the people that can help keep you alive if you get COVID-19. So I'd recommend that you don't do it. You shouldn't need to hoard toilet paper, as COVID-19 isn't a gastrointestinal illness. It's a respiratory illness. You should instead hoard things that support a good cause, like Girl Scout cookies. Here are another couple myths busted. Holding your breath for 10 seconds doesn't check for fibrosis. It does in fact only check to see that you can hold your breath for 10 seconds. And sipping water every 15 minutes will not wash the virus into your stomach where it's neutralized. It will, however, likely cause you to dip into that tissue paper hoard and visit the bathroom more often. Always check your source. As you can see here, this myth is brought to you by Money Secrets. And one final closing thought. Your pets are not going to get you infected. Unless, of course, your pet is a pangolin. At which point it might be better to consider an alternative pet. Please make use of these resources. The CDC has an excellent website set up to talk about coronavirus, and it's worth your time. Also check out the Arkansas Department of Health. They have a wonderful guide on what to do if you're suspecting that you might have COVID-19.